The health of an athlete is paramount. We marvel at their strength and endurance. We celebrate their victories. But sometimes, tragedy strikes. Sudden death in athletes is a stark reminder of the hidden dangers that can lurk beneath the surface. While relatively rare, the sudden loss of a young, seemingly healthy athlete is devastating, leaving families, teams, and entire communities in shock and grief. Sudden cardiac death is often the culprit in these tragedies. It's a silent threat, often without warning signs. Understanding the causes and emphasizing preventative measures are crucial to protecting our athletes. Hypertrophic cardiomyopathy, or HOCM, is a leading cause of sudden cardiac death in young athletes. It is a condition where the heart muscle thickens abnormally, particularly the left ventricle, the heart's main pumping chamber. This thickening can obstruct blood flow out of the heart, leading to life-threatening arrhythmias, especially during strenuous activity. HOCM affects approximately 1 in 500 people. It often goes undiagnosed, as individuals may not experience symptoms until they engage in intense physical activity. This makes routine cardiac screening even more critical for athletes. While HOCM is a significant concern, it's not the only cause of sudden cardiac death in athletes. Coronary artery anomalies, which are irregularities in the blood vessels supplying the heart, can also lead to fatal arrhythmias, especially during exercise. These anomalies can disrupt blood flow, increasing the risk of cardiac events. Other conditions, such as long QT syndrome, an electrical problem that affects the heart's rhythm, and myocarditis, inflammation of the heart muscle, also pose risks. Comprehensive screening should consider all these possibilities. Section 4. Early detection is key screening for silent threats. Detecting these silent threats early is vital. A thorough evaluation typically includes a detailed medical history, physical exam, electrocardiogram, and echocardiogram. The Schwartz scoring scale helps assess the likelihood of long QT syndrome based on ECG findings. The QT interval, a measurement on the ECG reflecting the heart's electrical recharging time, is crucial. A prolonged QT interval can signal an increased risk of dangerous arrhythmias. Section 5. Reading the signs. Echocardiograms and voltage criteria. Echocardiograms provide detailed images of the heart's structure and function. They can differentiate between physiological left ventricular hypertrophy, a normal adaptation to exercise, and pathological hypertrophy, a sign of underlying heart disease. This distinction is crucial in determining an athlete's risk. Voltage criteria, such as the Sokolow-Lyon index and Cornell voltage criteria, use ECG measurements to assess for left ventricular hypertrophy. These criteria provide valuable information about the heart's electrical activity and potential abnormalities. Section 6. Protecting our athletes. Prevention and awareness. Protecting our athletes requires a multi-pronged approach. Regular health checkups, including cardiac screening, should be mandatory for all athletes. Educating athletes, coaches, and parents about the signs and symptoms of heart conditions is paramount. Knowing the warning signs, such as chest pain, shortness of breath, dizziness, and fainting, especially during or after exercise, can save lives. Early detection and appropriate management are key to preventing these tragedies and ensuring that our athletes can continue to compete and thrive.